You've probably heard this before. Just go to therapy and your anxiety will go away. Or, take this medication and you'll feel better in no time. It's a comforting idea, that one solution can fix it all. But here's the truth that most people don't want to admit. That's the biggest lie about anxiety treatment. It's not one size fits all. And today we're breaking down what anxiety really is, what the diagnostic criteria or DSM-5 says about it, and why the way we treat anxiety often misses the mark for so many people. Let's start by understanding what anxiety is. Anxiety is not just feeling worried or stressed. According to the Diagnostic and Statistical Manual of Mental Disorders, which is the gold standard for diagnosing mental health conditions, anxiety disorders involve excessive fear or anxiety that is persistent, difficult to control, and that interferes with daily life. There are different types like generalized anxiety disorder, GAD, constant free-floating worry, social anxiety disorder, fear of social situations or being judged, panic disorder, sudden attacks of fear, heart racing, and breathlessness, specific phobias, irrational fears of objects or situations like flying or spiders, and each of these types can feel different, require different approaches, and respond to different treatments. Yet we often treat them all the same. Let's discuss the one-size-fits-all lie, the biggest myth, that any one treatment will work for everyone with anxiety. Many people go into therapy expecting instant relief. Others take medication and hope the anxiety will just vanish. But here's what research and experience both show. Anxiety is complex. It lives in your thoughts, yes, but also in your body, your nervous system, your trauma history, your lifestyle, and sometimes even your cultural experience. Just talking about your worries in therapy or just taking a daily pill might not get to the root of your anxiety. That's not to say therapy and medication don't work. They absolutely can. But they often need to be part of a bigger, more personalized picture. Let's talk about therapy first. Cognitive behavioral therapy. CBT is considered the most evidence-based treatment for anxiety. It helps you identify and challenge distorted thoughts and gradually face your fears. But CBT doesn't always work for people with complex trauma, neurodivergence, or deep emotional dysregulation. In those cases, more somatic or trauma-informed methods like EMD, eye movement, desensitization and reprocessing or DBT, dialectical behavior therapy may be better suited. The problem is, many people try CBT, don't feel better, and then assume they're unfixable, when in reality, the tool just didn't match the wound. Then there's medication. SSRIs, selective serotonin reuptake. Inhibitors like sertraline or fluoxetine are commonly prescribed for anxiety. These medications help regulate serotonin, a brain chemical involved in mood. For many, they reduce anxiety significantly, but for others, they cause side effects, emotional numbness, or don't work at all. According to multiple studies, about 30 to 50% of people don't respond fully to first-line medications. That doesn't mean the medication was wrong, it means we need a more comprehensive strategy. The nervous system is often ignored. This is where we get to what's missing in most anxiety treatment plans: your nervous system. Anxiety is not just a mental loop, it's a full-body experience. Your brain perceives a threat, real or not, and your body reacts as if you're in danger. You might feel shaky, nauseous, sweaty, lightheaded. This is the fight-or-flight response. If your anxiety treatment doesn't address the physiological side, through breathing techniques, body movement, grounding exercises, or even vagus nerve stimulation, it's like trying to calm a fire with a blanket over the smoke. You're not treating the fire, you're covering the symptoms. And then there's the context we live in. Many people live with systemic stress, racism, financial insecurity, gender-based violence, or generational trauma. Anxiety in these cases isn't just a chemical imbalance, it's a reaction to ongoing reality. A therapist who doesn't understand your background might interpret your anxiety as irrational, when really it's deeply rooted in lived experience. That's why culturally competent, trauma-informed care matters. So what actually works? Effective anxiety treatment is personalized, multi-layered, and patient-centered. The best outcomes often happen when you combine 1. Evidence-based therapy such as CBT, EMDR, and DBT. 2. Lifestyle changes like quality sleep, movement, and nutrition. 3. Nervous system regulation such as breathwork, somatic work, and cold exposure. 4. Medication when needed as part of, not the whole, treatment. 5. Trauma and cultural understanding. 6. Self-compassion practices. The truth is, anxiety healing isn't linear. You experiment, you adapt, and you stay curious about what your anxiety is really trying to tell you. The biggest lie about anxiety treatment is that there's only one way to heal. But the truth? Healing looks different for everyone. If therapy hasn't worked for you yet, you're not broken, you just haven't found your fit. Anxiety is not a flaw, it's a signal, a teacher. And when you understand it deeply, when you treat both the mind and the body, you begin to shift. Not just to manage anxiety, but to reclaim your peace, your power, and your life. If you found this video helpful, be sure to like, share, and subscribe for more mental health education videos. Also, check out our other videos. Together, we can help break the stigma surrounding mental health.